And
Good evening, Professor.
how you guys doing?
Good. I'm good. How are you?
Good, good. Glad to hear that.
Yes.
Okay, so let's see who else is gonna join the class. Do you guys have the chance to watch the video? A couple of videos that we
I did.
watched.
I didn't. Yeah, I didn't get a chances yet.
Okay. Well, let's see if we can watch it. Now I know how to set up the volume. It was pretty easy, but hey, I didn't know. But I learned already, so now I know how it works. So that's good. Maybe we can start by just watching the videos while we wait for the rest, if you guys agree.
That's fine.
Okay. So let's go back here and look for those links. Mhm. Okay, I think that this is the one. Let's copy it and let's open then right here in YouTube. Paste. Oh no, this is not the one. Sterilize. Oh, this is. The one. This is definitely. Okay, so let's cast this video. Okay, now you should be able to hear the or to listen to the video. Let me know. Can you hear now the sound?
So we're going to take a look at how to run an autoclave and how to prepare surgical tools for the autoclave. In a doctor's office, there are a variety of tools that need to be used for non-sterile procedures and for sterile procedures. There are certain ways that we must prepare these tools before they can be used in the office. And of course, after they're used, we're going to be cleaning them again before we can be putting them through the autoclave. Now, before we get started with doing the autoclave, what we need to do is we need to make sure that we have all the necessary supplies. Of course, we're going to need the surgical tools. And before we can wrap the surgical tools, they need to have been sanitized with a disinfectant and rinsed and then dried off. They must be completely dry before going into the autoclave because we can't get any of the paper wet and we cannot be introducing any excess moisture to the autoclave. So once we have our surgical tools ready, the other supplies that we're going to need is autoclave paper, and a lot of times it's just this blue paper. Sometimes people refer to it as CSR. And other things that we can use that some offices prefer are pouches. And they come in a variety of sizes. They're very handy to use. And as you'll see later when we do wrapping, this is a lot easier option. These are a little bit more expensive, but what's also nice about it is you can actually view the surgical tools once they've been, after they've been autoclaved. autoclaved, where we cannot view the tools after they've been wrapped. There are also a variety of pouches available. So some come already pre-made with a size, others come in a roll where then we can customize the size that we need, and we cut it and use tape to secure the ends when we're done. So I'll be showing you how to wrap tools first, and then we'll look at how to put instruments into a pouch. Okay, so to get started with wrapping, this is a little bit more complex surgical set, but it's a nice demonstration of how to wrap a surgical set. So for all of our tools that have hinges, we need to make sure that they're all open. The reason why we want to make sure that we put something in place here to keep all these hinges open is because we want the tools to be open so that all the surfaces are going to be exposed to the incredibly hot air that will be created by the autoclave. In the case of instruments like this vaginal speculum, it's also called a grave speculum due to the shape, we want to make sure that all of these clamps are open. As you can see, they can be tightened down and shut completely. So we want to make sure that they're open and loose. Also here, we want to make sure that this is also open and loose so that the whole instrument is moving freely. We know that all the surfaces are then open to the air. We want to make sure whenever we're putting together a package that we're putting it in an order or in a fashion that works well with the practitioner and how they would use the set. For the tools to assemble a vaginal pack, and this will vary from office to office, I put the speculum at the bottom, I put the sound on the bottom, I put the tenaculum next with the cotton, I have the uterine forceps next, and then the towel forceps or ring forceps, and then I place the cup. The last item in the kit is an indicator, and what it will do is it's going to tell us that the temperature inside of our kit that we made got to the proper temperature that we need for these tools to be sterile. So we want to make sure that we put one inside. Okay. When we're folding them, it will be based on the size paper that we have and the tools that we're folding. The general idea is that we want to make a kit that it can be easily opened without compromising the sterile nature of the tools. So we make these little lips so that someone can go and grab it and pull it in that fashion without ever touching the inside of the kit. So I like to get rid of some of the excess paper by folding it up like that and then coming over I tend to use my full forearm to be able to secure my paper as I'm rolling because we do not put any tape on the inside. And then fold that down. Now we will do the second layer. This will be the same idea in that we want to make lips in the paper so that we're not touching the inside of the wrapping. Folding over again. Getting some of the excess paper folded up inside. And then folding it down. Our end product does not need very much tape to keep it closed. It is tight, but not too tight. It allows for airflow with inside the package, but keeps everything well bundled. The tape we're going to use to close up our pack is very specific tape. This is autoclave tape. It can handle the temperatures that we're going to put it through in the autoclave, and it also has an indicator built onto the tape.
Sorry, I can't see anything.
I usually like to make a little fold at the end of the longer piece of tape so that it's easy to open. After this tape has gone through the autoclave, it will develop black stripes along the outside of it if the autoclave reached the proper temperature. This way we know that
Sorry,
the outer
Professor, I
part
can't see anything.
of this package reached the proper temperature.
Hello.
Sorry, Professor, I can't see anything.
You cannot see the video?
Correct.
Oh, that's kind of odd. Are you using a cellular phone?
Temperature.
Are you taking the class through using a cellular phone? Oh. I can see it here. Okay. Let me see my cellular phone myself. See why it's not. Are you not seeing it? Okay. Like the video now.
Indicator strip on the inside tells us that it also got that hot on the inside as well. Before we put it into an autoclave, we want to make sure that it's always labeled. In our office, we use an abbreviation for all the contents of what is wrapped. That's for other offices. You may list every object that's found inside of this wrapping. So that's what we firstly need to have on there. It's what's surgical. Next, we need to include the date that we're going to be autoclaving it, and we need to include our initials to allow people to know that we will put this together. Just in case later, if any changes needs to be done to the procedure, we can do that.
Oh, well, I'm being able to see. Anyone else cannot see the video? So you hear it, but you don't see it.
Yes, I can hear that, but I cannot see the video.
That's very... That's pretty odd.
didn't work for me, but I couldn't figure out why until I went.
What about now?
It's good now.
Okay.
Thank you.
I don't know where it was.
One way that will prepare instruments for the autoclave is to put them in a pouch. These sterilization pouches are already ready to go with an indicator on the package itself. So we do not need to put an indicator inside them. What will happen is these arrows on the outside of the sterilization pouch will change color when they've been sterilized properly. Is when we're putting in instruments, one of the key things is that when we actually open them, they're opened in this direction. So when we place an instrument inside, we want to put it handle down first. Okay? This instrument stays open by itself, so we don't need to worry about having any cotton in there. If we were placing an instrument in here with hinges, the next thing we're going to do is just pull off the tape and then fold it over. One of the things with these pouches is that they must be folded exactly on this line. That means that it's been properly sealed. Now, when we're going to load our autoclave, now that we have all of our tools ready, we'll probably have a variety of tools. Things that are wrapped, things in pouches, need to be wrapped or put into a pouch. Some objects are used for non-sterile procedures but need to be very well cleaned. So they will be sanitized and dried, and then they'll be put in the autoclave to be fully cleaned. And then we will store them in a clean drawer until they're used. A lot of autoclaves are very different. So whenever you get working in an office, you'll want to get out the autoclave manual and get familiar with the autoclave that you have. So the process of autoclaving is based on steam being pressurized and superheated above boiling temperature. So we want to make sure that there's plenty of water inside the autoclave. Though we need to make sure that we use distilled water, because tap water can have other minerals or other material in it, so it may not work well and it may harm the autoclave. So each time we go to use an autoclave, we want to check the water level and make sure that there's plenty of water in there. Once we know that there's enough water, we're going to load our autoclave. Just like the idea, when we were wrapping our instruments, we want to make sure that all surfaces are going to be heated by the steam inside the autoclave. So all surfaces have to be touched by that steam. So they all have to be evenly distributed in the autoclave. Some autoclaves will merely have a chamber that you must fill. And so in that regard, you would want to try to stack your items in there, have enough items that then everything would be arranged in a fashion that the steam could flow up through and around all of your packages. Other autoclaves offer trays to be able to make sure that there's even airflow between all of your packages. So we want to make sure that we organize our items in our trays so that we can okay, this is going to allow for enough air to move around. I might be able to get a few more instruments in here, but this is actually a pretty small autoclave. So we're also going to an indicator because we are including items that are not wrapped. So we want to make sure that as we're putting it in, we're including the indicator for that instrument. So now we'll want to secure the door. Each system is going to be different. In this case, we have a crank to make sure that the door is secured and tight. Other autoclaves have a gasket system and a latch. In this type of system, we want to make sure that this is really nice and tight, because we don't want this to open up, and we need it to reach a certain amount of pressure, so that chamber has to be sealed. Before we turn it on, we're going to get everything set. One of the issues is time. For general packs and wrapped items that need to be sterile for surgical procedures, we want to make sure that they've been at least for 30 minutes. So we could turn our dial to 30 minutes. We also want to make sure that they at least get to 250 degrees Fahrenheit or 121 degrees Celsius. The manufacturer will recommendation for different types of wrapped items. And then we will turn on the we'll turn the dial to sterilize, and then turn on the autoclave. When the autoclave is done, we will, and after it's depressurized fully, then we can open up the autoclave. And each autoclave will have its own system for how it allows you to know that the autoclave is ready and done to be opened. All the items should be dry when we pull them out. So we will undo the door. And when we remove them, some offices have different procedures for putting the items away. Our office has us wear gloves when we handle things that have been sterilized and put away. This is especially important if you have any breaks or sores on your skin or any dry skin. A lot of procedures have to be done with gloves on to make sure that we're protecting our patients. When we remove it, it should be cool to the touch. Sometimes after it's done, this can be quite hot and needs time to cool. But if it's ready to go, we can pull it out. And the next thing we do before we put it away is we want to make sure that everything was done properly. So we'll be looking to see that the arrows had changed color and had been properly autoclaved before we put it away. Our tape will have changed color on our wrapped items. Our indicator will also have changed color to allow us to know that it's been fully sterilized. And then we know that all these items have been sterilized properly, and now we can put them away in the clean drawers where they're kept until they're used for a procedure.
Okay, so this time we have the opportunity to watch those videos. Once again, I have emailed you the link, so whenever you have the chance in your own time, if you didn't have the opportunity, so you can just go over them. All right, so not a big deal, but it is important that you have an idea of how it works. Okay, so let's go back to this chapter that we left off yesterday, which was preparing the examination room. We're going to continue with this lecture, and then we move to something else. So the last part that we covered were these two type of hearing tests that we use, the turning fork for it. So once again, as I mentioned yesterday, this sometimes comes in exams. So the only question that you are going to have about these tests is just to identify the tests. They're going to give you the Rene test or the Weber test, and they're going to ask you what type of test is it? What is it that this, what is it that's going to be testing? So the Rene or the Rene or the Weber tests are used for testing hearing. Remember, that is basically what it is. They're not going to ask you about the turning fork or anything else. What is the procedure? What is it that you're testing? How you do it? No, it's only knowing what the test is all about. What is it that you're testing, basically? So now we're going to move to the room. Remember, because we are preparing the room for the patient. Always, as a medical assistant, we are going to be preparing everything. From the moment that the patient comes into our office, we're going to register them. If we are in the front desk, and if we are not, we are going to call the patient from the waiting area after has been registered and move to the back of the office, which is the clinical part. And you probably have already set up this office for these patients and for the procedure that the medical doctor is going to be performing. So that's how it works. Now, what other things you should have in the exam room? What is it that, what supplies you need? What type of equipment you should have? So we talk about the equipment later on, so yesterday, and today we're going to talk about supplies. And then we're going to move on to how you are going to clean the tables or the exam tables or beds, if you want to call it that way, but we usually will call it the exam tables. So how you're going to clean it, what disinfectant you're going to use to clean it, and then after it dries off, we're going to apply the paper and cover the table again for our next client, customer, patient, whatever the case may be. So things that we always have to have in our exam room are gloves. Now, not only non-sterile gloves, but surgical gloves as well, sterile and non-sterile gloves, because we never know what procedures are we doing. Depends on the specialist of your doctor. Remember, some doctors, they do biopsies. Some doctors, they do pap smears. Some doctors, they place on stitches on the patient. So for that reason, if we're going to get in contact with, the inside of the patient or through the skin, we got to wear these surgical gloves. So you have to have all of them just in case. And different sizes. Remember, you have to learn what is it that the size that the doctor that you're going to be assisting, the size of the gloves that they wear. And they have preferences. Sometimes they want this type, this brand versus that other one. Because in the medical office, you can have different brands or different supplies. So you need to get familiar with those. Some doctors want certain brands because they want the gloves, they just fit them pretty well. So, or they just used to, I want this ones, I want this size. So that's what we're gonna do. Remember, we're gonna work for them, we're gonna be assisting them. So we gotta provide them what they need. And we gotta get familiar of what is it that these doctors prefer. So get familiar with them. Don't just bring anything to them, assuming that that's the first thing that you grasp or something that you think that that's what they need. No, get familiar with these doctors because they have certain preferences and they will decide later on where they want to have you or not. Some of the medical doctors don't want certain medical assistants that do not follow instructions. So make sure that you familiarize with the exam room, with the materials, with the supplies, with the equipment. Once again, because if this medical doctor comes to see the patient, they want to have everything already set up for them. They don't want to waste no time. Other than that, they can turn around and tell you, when you're ready, let me know. And now, a waste of time. Remember, we cannot keep the patients waiting too long for the medical doctor. They're not going to be happy. And you're going to be just going to start having a little problems there. So gloves, Definitely. Water soluble lubricant. Why? Because sometimes we use instruments that we need to put some lubricant on them because they're going to go into certain openings of the body and we don't want to harm them. So we use this water soluble lubricant. Once again, make sure that you know where all these supplies are. Always walk with someone else who's been working over there before, or just ask. Remember, sometimes the doctor doesn't know whether you are new or not, because that doctor probably was not the one that hires you. So they're not gonna say, "Oh, do you know what to do? Do you know having experience or whatever?" Well, some of the doctors are nice, some others not so nice. It's like everybody else. So get familiar with them. Learn what they want, how they want things to be done for them. Remember, everybody has their own techniques to do things. So learn how they work. Otherwise, they're not gonna pick you if next time they need someone that needs to be assisting them. So basically, that's what it is. A tone depressor. That's another thing. That's like a little spatula, wooden spatula. That's the one that sometimes they ask the patient to open their mouth and they put it all the way down to suppress. That's what is called tongue depressor. To depress the tongue and look all the way back on the pharynx. So that's basically how it is. So all these needs to be there. These tongue suppressors are not sterile, so don't worry. They are usually in a package. You just pick them up with your gloves on, of course, because remember, you don't want to touch them with your bare hands because the patient is going to say, oh, wait a minute, they're not wearing gloves. So make sure that you follow all the protocols. It is kind of sometimes common sense, remember. Tissue. Tissue is gauze, whatever size we have 4x4s, 2x2s. So make sure that you do have the gauze ready, available if the medical doctor is going to do a procedure. Remember, we need to be familiar with everything and make sure that all these supplies are there. Cotton tip applicators. Remember, sometimes we do a nose swab. It's like a Q-tips. We do a nose swab or a throat swab or maybe collection of vaginal fluid or seminal fluid with this little cotton tip applicators. So you need to have them over there. Specimen containers. When we talk about specimen containers, we talk about these little containers to collect urine. So we need to know where they are, just in case the medical doctor needs it. For those who have been with me in prior lectures, I'm always been telling you that the best thing to know what is it that the doctor is going to be doing is by the time that the patient comes to the office. Remember, it's very important to understand the reason what the patient is visiting your office, because the chief complaint is going to tell you what the doctor is going to do. So you're going to be ready, prepared to get all these supplies in advance. So that's basically how it works. We don't wait for the last minute because we know that these procedures are going to be performed. So for instance, the patient comes and he says that they're having a chest pain. So they are about 30s, 40s, 50s. Pretty sure this medical doctor is going to order an electrocardiogram. Remember, the patient is presenting problems with their heart. How we are going to test that? We're going to do, once again, an electrocardiogram that we call it for short EKG or ECG. So just knowing, looking at the medical chart, if you weren't the one who registered the patient when they showed up in the office, so read the medical records. Go there and see, oh, how many patients do we have today? Like 10, 20, whatever the number. So check the order in which, the patients were registered, because that's going to be next. Look at the chart. Look at the chip complaint. Oh, I'm having burning sensation in urination. Oh, you know immediately that the medical doctor is going to order urine. So we're going to be prepared for that. So again, the patient comes because he's having a complete physical exam. The patient hasn't been here for a year or maybe two. Well, the patient is due for a complete physical exam. If it is male, they're gonna do an electrocardiogram, 100%. If it is a female, they're gonna do a pap smear if that office runs those tests over there. So depending on who you're working with, you know for a fact that these patients are gonna get blood, urine, and some other tests, particularly females, the pap smear, males, they're gonna do then EKG. So that's basically how it works. So we gotta be ready. We gotta understand. Because if you're not paying attention of who is visiting your office and for what reason, then you're missing a lot of stuff. So then when you have to assess, you don't know what to do. So that is the purpose of all these classes, to prepare you, to make sure that, nothing is going to take you by surprise. So always get familiar. What is this patient here for? And think ahead of hand. Oh, this patient probably is going to need this. So go around and try to figure out where things are. If you need it, well, if you don't, you'll learn what the things are. Remember, you might be the one who's going to be assisting or performing certain procedures to the patient because you're a medical assistant. And as a medical assistant, you're going to be drawing blood, you're going to be collecting urine, you're going to be doing electrocardiograms, you're going to be doing vital signs. So that's part of your regular tasks, everyday tasks. So you're going to be familiar with them. And that's what this chapter is all about. If you don't know something, if you forget something, no worries, ask someone else. Hey, this is my first time here. Can you please show me where these urinary cups are? Or urinary containers? Whatever you want to call them. Do you know where the tongue depressors are? Where do you find these gauze? Because remember, there are 2x2s, are very small ones, and 4x4s, larger ones. So you need to be familiar with all those things. Where the gloves are, where the sterile gloves, non-sterile and sterile gloves are. So familiarize yourself with these exam rooms or the laboratory room where you're going to be working, because that's something you're going to be needing. The worst case scenario, the worst thing that happens to you is, that you completely lost. You know how to draw blood, you know how to do an EKG, but you don't know where the EKG machine is at. Oh, you didn't check the paper of the EKG machine, and now you don't know what the paper is at. So we got to be prepared because these tasks are everyday tasks. Someone is going to get an EKG. Someone is going to get blood collection. You're going to do vital signs for almost every patient that comes into the office. These are regular routine tasks. So for that reason, you need to be familiar. So here are, a list of supplies that, might be needed when the patient comes into the office. Just review it. I mentioned them already. So it might be more, all depends what is the specialty of the doctor that you're working with. So remember, yesterday I mentioned it. When you get a job, when you get hired, know what the specialist of this person that is hiring you is all about. What is it that they do? Because whatever they do, that's exactly what you're going to be assisting them with. See, if you're going to work with an urologist, you're going to be doing a lot of procedures. If you work with a gastroenterologist, same. So again, you work with an GYN doctor. These are the doctors that do the pap smear all the time. They do the, gynecological examinations. So you got to familiarize yourself, because we're going to see later on the positions that we are going to be placing the patients depending on what procedure the doctor has ordered for the patient. Some things are independent from others. Some things are that you prepare yourself. You prepare the room for the medical provider. Others, you prepare the room for you, because you are going to be doing certain procedures on your own, like drawing blood, like doing EKGs, or drawing blood. So that will be your task. It's not, the doctor is going to give you the order, and you just have to accomplish that. So that's how it works. Don't be afraid. I'm not trying to scare you. Oh my God, this is too much. No, it is not. This is a routine thing. It's just that if you are not familiar with this type of setting, you're not gonna know. But that's the reason that we go over all this material, so you can familiarize yourself. And when you get there, you know what to look for, you know what to ask, or, to check and to review your materials or to ask someone else. That's how it is. So don't ask everything, because then can say you definitely don't know anything. Ask what things are, not how they look like. Then that's going to be a little problem. So once again, these classes are for to give you some basic knowledge of the things in general that might happen. So review your material, familiarize with this. Before you graduate, if you have to go to the medical doctor for an appointment yourself, or you bring a relative, look at everything that they do over there. From the moment that you enter and somebody else greets you or not, or ask you what you're here for and what things they do, that's exactly what you're going to be doing. So familiarize with those things. Pay attention. Every single time that I go somewhere, I always see what they doing, if it's not my field, because I need to know. So next time that I go somewhere else for the same things, then I'm gonna say, oh, this did this, and this one did it differently. Oh, why? Or at least I have, ways of, asking for clarification or having questions after. So it is important that you familiarize with this. Maintenance of the exam room. Remember, like anything else, if you are in your laboratory, if you are in the front desk, we have to keep these areas clean. But here is where the patient is going to come, because the patient, whether you're going to do a procedure or the medical doctor is going to be doing a procedure, and you are going to be assisting the medical doctor during that procedure. So you got to make sure that this room is squared away by the time that the patient arrives. You do not bring a patient from the waiting area to a room that it is unsafe or messed up. You don't. You clean it, you square it away, and then you bring your clients over there. That is how it works. So one of the things that you have to do, usually this is done at the end of each procedure. Because when I'm talking about procedures, the patient probably is getting exam tables. Remember, it looks like a little bed, like an, but actually we call exam tables. So that paper needs to be removed after the patient leaves, after the procedure has been done. We have to clean that table. Paper is removed. The table is cleaned with Clorox or bleach or hypochlorite. Those are the different names that this chemical receives. 10%. Remember, this is question for exam. What is the most common disinfectant that we use in the medical, in the laboratory, and anywhere in a medical setting? That's going to be Clorox or bleach or hypochlorite. Luckily, you're going to find the name Clorox. 10%. It's not 20, it's not 100, it's not 90%, it's 10%. And Clorox is a disinfectant. Remember, this is for cleaning surfaces, dead surfaces. This is not for living organisms. For living organisms, we're going to use alcohol. We're going to use peroxide. We're going to use iodine and other chemicals for that purpose. But for the cleaning, we are going to use Clorox. It's the most common disinfectant. So every single time that you see questions, how you're going to clean the surface of the floors of this or that, then you're going to be thinking about Clorox because that is 100% the answer. Not 100% potency, no, it's 100% the answer. But the Clorox, the bleach, or hypochlorite, it is 10% the one that you're going to use, the concentration. Then you're going to allow that table to dry, or you're going to dry it off with a disposable paper towels. Then you are going to pull the paper back. So you're going to pull from the roll because those rolls usually are attached to the head of the table underneath. So you just roll it up and you just gonna cover the table again for the next patient. So that's basically what we need to do. We're gonna disinfect every single area that was used for the purpose of the prior procedure. We need to do that. We're gonna clean or sterilize any instruments that have been used during that procedure. Remember, you have to familiarize with the instruments, not that you need to know every single name. No, you have to familiarize with the instruments, whether they are disposable or reusable. If they are disposable, do not worry. Those instruments goes inside the sharps container. Anything that's being used and for the purpose of the procedure that the medical provider have done, if it is disposable, you are going to discard them inside the sharps container. So that's basically what it is. For those ready to phlebotomy, they know what a sharps container is. And for those who are new to this program, no worries. When we get to this module, phlebotomy, I'm gonna show you all that. And we're gonna do it. We're gonna use it because we're gonna discard lancets, the tubes, anything, these blood tubes, collection tubes, that can be discarded over there after, we have processes and we don't need it anymore. So basically, that's what it is. We're gonna ensure that the room is free from odors. Remember, some patients have certain, humor, not humor, haha kind of thing. No, is they kind of breathe through the skin, and when you place them in a table, the entire room develops certain smell. So, or you did a procedure in which, you incides the medical was incising a boil and that has pus inside. Or you working with a podiatrist and he was removing something from the food and the smell stays, remains in those rooms. Unfortunately, not every single room in the hospital has windows. So most of these rooms don't have windows. So everything is kind of enclosed. So these smells, these odors do not leave the room easily. So we gotta use refresheners. We gotta place something, we gotta spray something so we can make the room, for the next patient a lot more comfortable. Because think about it, entering a room that smells bad, it wouldn't be a good idea, right? So for that reason, don't bring your patients until you square away these rooms. That is basically what you need to do. So here we have a medical assistant. Let's assume that this is a medical assistant, removing the paper. So this is the exam table, remember? And there was a patient probably that they did some procedures, was laying on the table. Now this paper needs to be removed. Then what's going to happen? The table has to be wiped off with, clothes wipes or with spray that contains Clorox. And then we use the paper towels, disposable paper towels to clean that. Then we dry it off. So that's how it works. And then we get it ready. And then remember the paper, there is a roll of paper right here underneath. From this side to this side goes underneath. So you're gonna pull that paper all the way down. And then you're gonna cut it. The foot part of the table. So that's basically how it is. So it's not difficult. It's just that you need to familiarize yourself and familiarize yourself how to change that paper if that paper runs out. Because remember, you need to know what the paper are. This is a, table paper. So you need to be familiarized with all these procedures. So if you don't, then you're gonna miss out. See, from here, from this area, it was pulled out. See, the paper is underneath right here. And it's going to be rolled all the way to the foot part of the table. And then you're going to kind of tug it in underneath here. And that's it. You're done. And then you square away all your supplies, because here you see you have all your supplies. Here you see the otoscope, the ophthalmoscope, the blood pressure cuff. You have a lot of stuff right there. So you need to, once again, familiarize with the room, the supply. There is cabinets right here. Probably they have gauze, they have the tongue depressors. Now the tongue depressors are around here. The cotton balls are around here. The gauze around here. But here you might have needles. You might have something else. The gloves, most of the time, they are on the wall. See, small, medium, large, extra large, if there is extra large. So familiarize with everything, because you never know, you might encounter in a situation where the medical doctor is gonna ask you or request for something that you probably didn't prepare for, or it was not part of it. Something else happens, but you know where things are, you know where to find them. So that's basically what it is. This is not difficult at all. I did all this and more, of course, worked 4 years as a medical assistant. So I did a lot of stuff. So you learn. So make sure that you just, you're there. You wanted to do things. So what is the role of the medical assistant during patient's preparation? Well, remember, one of the things that you need to understand is, see who's your patient, who your clients are. You might have an elderly patient, hard of hearing patient, or partially blind or blind. You need to be prepared. That's what I told you. As soon as the patient arrives in your office, familiarize with them. What is it? What they here for? Who are they? Are they children? Are they just adults? Elderly people? It is female? What is the problem? What are they here? So that's how we solve things before things happen. So that's how I learned. That's how I work before. So that's basically what you need to understand. Let me put here. Log my computer, log me off. So that's basically what it is. Does the patient understand the instructions? Once again, checking out your patients, do they speak your language? Do they have a language barrier? Oh, can you please just, go up to, the table and can you remove your clothes, please? Remove this part. But then the patient doesn't understand you. So you got to make sure that they are following. And when you tell them, because remember, every single time that you bring a patient to an exam room, you have to explain them, what is it? Why are you bringing them to the room? What's going to happen in that room? What is the doctor going to be doing? What you are going to be doing? Don't just call them out and say, hi, Mr. Smith, can you follow me? And then you bring to the room and then you just leave them over there. That doesn't work that way. Explain them. Oh, by the way, Mr. Smith, the doctor is going to be performing this procedure. They're going to be doing this. They're going to be doing this. They're going to be doing this. That's basically what it is. When you explain them in a very basic terms, what is it that is going to be done to them, you're going to ask them also, have you ever had this procedure before, Mr. Mrs. Smith? Oh, no. Then you give a little more detail. Don't use medical jargon, remember. Oh, the doctor ordered an EKG. Oh, patient have no idea what an EKG is. And you just tell them that, but that's it. But what is an EKG? Oh, I'm going to be drawing blood. Oh, really? So they might not want it. They might refuse. So tell them what is it that you're going to do. Oh, hi, Mr. and Mr. Smith. The doctor ordered some blood. So I'm going to go to the laboratory. Tell them what you're going to do. Don't just say, follow me. I've seen this many times. Mr. Smith, yes. Oh, please follow me. And you're not telling them anything. So it's not that as you walking with them, because they're going to be following you, tell them, oh, hi, how you doing? Blah, blah, blah. Bring them over there. Because you might be doing the procedure. And if you are nice, these patients are going to comply, meaning they're going to allow you to do it. But if you kind of rude, kind of, like you don't care about them, then they're just going to dismiss you too. Oh, I'm going to do procedure. Oh, well, when I come here, usually someone else does the procedure. So don't get upset either. Don't take it personal. That happens all the time. It happens to me many times. Oh, are you new? They ask you a lot of questions. Patients ask questions too, because your face is not familiar to them. Like their faces are not familiar to you either, so you don't know who they are. So for that reason, we treat almost everybody with the same respect, courtesy. We gain their trust. Remember, this is the first impression that we're going to give it to them. When I call my patients, I'm just talking to them. By the time that I'm walking on the hallways in a very low tone, oh, well, so you hear, the doctor just ordered, a test. I'm going to explain it to you later on when we get to the room. And I'm going to be, very empathetic. I'm going to put myself in the situation of the patient. Hey, I've been waiting here for an hour, and this person just called me and put me in that room. I'm going to be very upset if you're not talking to me and tell me why you brought me here if you're going to leave me here. No, tell me what's going to happen. What is it that's going to be done? So it is very important to communicate with your patients, remember. Now, sometimes we have patients that comes with members of the family members. The family members sometimes are a pain. Don't take it personal. I've seen many people, arguing with the companions, with the home care. No, you don't have to. Because sometimes they are the ones who bring the patient for some reason. Or you have family members that they are very concerned and they ask many questions. So you're not going to answer those questions. You're just going to tell them, I'm sorry, I cannot disclose that information to you. But, when the doctor comes in, you probably can ask the doctor. But don't volunteer anything. Oh, I'm going to be doing this. I'm going to be, no, because that's for the patient. If they are there, they can hear whatever you tell them. But if they ask you questions, and how long it's going to take, and what is it that is going to be done, and they did this last time, and I haven't seen you here. Do you know what you're doing? Are you new? All these questionings that sometimes may, make you a little uncomfortable and make you probably snap. You might raise your voice saying something that they might not like it, and then problem starts. So relax, no worries, just do what you have to do. Don't raise your voice, even though if you don't like what they're asking, no worries. That's not going to harm you at all. But if you respond back to these people, then you're going to get in trouble. So just make sure that you act very professional with companions and the patients. If they ask many times, the patient is asking you many times the same thing, they might have some psychological, mental issues. So explain it again, but use different terms. Do not repeat the same story over and over. Use different wording. Probably the wording that you're using, they're not understanding it. And once again, make sure that the patient actually understands your language. Because other than that, get a translator. You don't want to get into a situation before the patient, before the doctor comes into the medical room to do procedure, because you already have certain, inconvenience with the patient. So that's not going to be good. So that's basically how it is. It is simple. It's just that we don't see it that way. Once again, it is common sense. Treat these patients the way that you would like to be treated. If they have a question, how many times you have questions, and these people try to brush you off, not tell you what it is. You're going to get upset, right? Or they start going around just to kind of dismiss your questions. That's not good. Remember that you as a medical assistant, you're not supposed to be answering every single question. But you can explain then what the procedure is going to be in very basic terms. Anything else, leave it to the doctor. The doctor is going to be with you shortly. So keep those questions when the doctor comes in, okay? That's it. Oh, why are you not telling me? Oh, I thought you knew. The other medical assistant always tell me, oh, the other nurse, because they call you a nurse. So again, don't get into confrontation. Not a problem. when the doctor comes in, please, you can ask those questions, okay? Anything else that I can help you with? And that's it. Don't dismiss them because they're gonna notice, they're gonna get confrontational, and you're gonna get in trouble. Be nice all the time. And believe me, you're not gonna have any issues. I did that and I know how it works and it does work. Remember, become an actor. If you're not the type of people or person that you have a patience, you have to get some patience. Here, you have to act. Get the patience from whenever you have it, or you don't have it, borrow patience from someone else, but you must have patience because these people sometimes are gonna make you really, really explode. So be careful. Patient's instructions. Now, when you give instructions to the patient, remember, you're going to be using, plain language, uh, language that the patient can understand because they didn't go to medical school or medical assistant school, so they're not going to understand medical terminology. So that's basically what it is. And if you have to give instructions to the patient after the procedure for something that they have to follow up, cause procedure, then you're going to give instructions in the language that the patient speaks. You're not going to give me English instructions when I do not speak English. Oh, no, but you have a family member that does, right? Who is the patient? Oh, me. So I don't speak English. You should give me some instructions in the language that I speak. So that's basically what it is. Anytime that we give instructions, we give verbal instructions first, and then we're going to give written instructions because the patients are not going to remember anything that you told them. They're going to remember at that moment, but they don't know what it is, and they're going to forget, and they're going to forget all the steps. But then, if you give written instructions, they're going to kind of put it together because they're going to follow certain order, certain sequence. That's how it works. Do not ask the patient, do you have someone over there who speaks English? That doesn't sound good, and it's not professional at all, because we know during this training that I told you that we are going to print out information in the patient language. Unless it is a language that you never heard about it and we don't have it in the system, that will be a different issue. That is something else that, there's no way we can fix. We have instructions for procedures of post tests or post examinations that or medications. We have instructions for them in most of the languages. So make sure that that you think about that before you start releasing your patients. Any questions about how to prepare the rooms, how to have all the supplies ready in the room, and how to clean and keep maintenance on that exam room, because it's very important. Any questions? Okay, so let's move to the next chapter. Wrapping articles. Okay, so this is not right here. It is assisting with the physical examination. Now, there is another chapter before this one that is called, the vital signs. We're not gonna do vital signs until the last. If I give it to you at the beginning, then you're gonna forget at the end. So, and it's a very, very important chapter. I mean, all the chapters are important, but this one, vital signs, is very important because you are going to be doing these particular procedures every single day for almost every single patient, at least one of the vital signs. So I'm gonna leave it for last so you can have it kind of fresh because we're going to have a lot of questions for your exam from that chapter. So I'm going to leave it for the last one. And, it's going to be fresh in your brains for you when you need to take the test and later on when we need to do some practicals. Okay. So assisting with the physical examination. Remember that these chapters are correlated, the one of preparing the room. And now, why are we preparing the room? Because we are going to bring the patient. Now we're going to pick up the patient, whether from the waiting area or the patient just were seen by the doctor in one of the rooms, and then the doctor orders a procedure, and we got to get this ready. So that's basically what it is. So when we are going to prepare the patients for physical exam, remember, if we're going to fix the room, we have to make sure that everything is squared away, that we have all the supplies. You know, that the room is the patient. Now we need to have certain supplies, certain equipment, because now we're going to instruct the patient what to do, how to prepare for the procedure or the exam or the evaluation, whatever the case may be. So one of the first things that we are going to do is, most of the time, the doctor orders the patient to change in a gown. This is very common when we're gonna do procedures. Why? Because if we're gonna do a procedure, we're not gonna do it with your regular clothes on. So we're gonna make you feel a little more at ease, more comfortable for the medical doctor to do the procedure. But we have to take in consideration lots of things, remember, because removing your clothes is not something pleasant. People who are doesn't feel comfortable doing that, but sometimes we have to do it, and that's the reason why we have gowns. Now, know exactly what is the procedure all about. What is the evaluation that the medical doctor is going to do? One of the big, I might say, misconceptions or mistakes that medical assistants do is asking the patient to remove their clothes. Oh, here is this gown, please remove your clothes. Now, if the doctor is going to evaluate the patient from the waist up, what is the need of the patient to remove or the clothes? Remember, the patient is going to be feeling very uncomfortable exposing themselves. So if there is no need for the patient to disrobe the entire body, so then you shouldn't put the patient in that situation. You have to be very specific. If the medical doctor is going to do now a vaginal exam, a rectal exam, or a breast exam, or some of the kind, well, we gotta only get the clothes from that area. That's what we explain the patient. What is it that the doctor is gonna do? What procedure? And for that procedure, you need to remove, disrobe these particular garments from you. So that's what we do. You see how important it is to know what is the reason that the patient is there? What is the reason? What is the procedure that is going to be performed? Because then you know exactly which instructions you're going to give to the patient. But remember, that is very important for the privacy of the patient, for the dignity of the patient. You don't want to embarrass your patients, or you don't want to go through certain issues with the patients. So again, that's very important. Then if the medical doctor is going to do some type of procedures, we need to know exactly what position the patient is going to be placed. So we're going to go over to certain medical positions for examination. So if you don't know, then you're going to get familiar. But once again, depends on what is the chief complaint of the patient, we're going to have an idea more likely what procedure the medical doctor is going to order. Remember, familiarize yourself with the specialty of your medical doctor. What does this medical doctors do? Because some of the things that this particular medical, this other one doesn't because it has a different specialty. So familiarize yourself with that. So the position that we are going to put the patient in is according to what procedure is going to be done. What type of procedure or what type of evaluation the medical doctor is going to be conducting. So that's basically what it is. Now, remember, when you give a patient a gown, you got to know whether the opening is going to be on the front or the opening is going to be on the back. Depends on what procedure is going to be done. You don't want to be telling the patient, particularly the medical doctor, is going to enter the room when the patient is ready, and now the doctor is going to say, they're going to look at you. Why is the patient having the gown, the opening to the front? I'm going to examine the back. Why is the gown closed on the back or tied up on the back? I'm going to be evaluating the patient in the front. So now you have to ask the patient to remove the gown to put it the right way. So all this, number one, is a waste of time. That is lack of preparation and knowledge. So probably the patient might not realize anything, might be uncomfortable removing that because now there are two people over there that have been watching this patient. Remember, you have to keep privacy with the patients when they are disrobing, when they are changing clothes. You got to pull the curtains or close the door and leave the room if there is no curtains there. You can't be in front of them checking what they're doing. No, you got to provide them with privacy. That is part of the HIPAA regulations. So now the patient has to remove their gown in front of two people, maybe three, something that they did it on private and they have done it correctly if you have given instructions correctly. So that's how it is. So it's very important for us to know. Now, once again, remember the temperature of the room, because the temperature of the room sometimes, not sometimes, most of the time in the medical office are cold, are below environmental temperature. Then provide your patients with a blanket. It says there drape. Yeah, a drape can be one thing and a blanket another thing. A drape is something that you're gonna place to cover the, the sensitive parts of the body if the patient is going to be exposed. Because it says right there, drape, you have to provide one to minimize exposure or non-essential parts and provide also warmth. Because remember, the rooms are cold, so you're not giving these drapes or blankets just to protect their privacy, their sensitive parts. You don't want to expose them, but also, to cover them up because the rooms are cold and you ask the patient to remove some or part of the clothes from this patient. So they need these drapes. Any questions up to now? See, I'm trying to go slow. I'm not in a hurry because that's not how it works. Trying to give you most of the information so you can kind of, absorb most of this information, and then you apply it when, when the time is right. So the gowns, there are different type of gowns. There are cloth gowns, there are, waterproof gowns, and there are disposable gowns. You are going to be utilizing the gowns that you have available in your office. So you have to familiarize, and depending on what procedure is going to be done and what are the preferences of the doctor that you're working with. Remember, you must get familiar with these doctors. If you're working with this particular doctor, familiarize with the things that they like, how they want things to be organized, what type of brands they want to be utilizing. It's not this one, that one, the first that you pick up. Familiarize with that because they're going to be telling you. And if they tell you more than once, believe me, you will not last working with that doctor. If that's the only one, well, you will not last in that place. So again, before the patient remove their clothes, you got to be specific. You have to tell them exactly what part of the clothes they need to remove. Remember, that is crucial. It is very important. Now, one more thing. Always offer your assistance, particularly when you have patients that are elderly or patients that have some physical or mental disabilities. So if they have any problem removing their clothes because they have a physical disability with their hands or the body or moving around, so you offer your assistance. You tell them, Mr. Mrs. Smith, if you need any assistance, please let me know. Do not get impatient because the patient is not hurrying up, changing, moving fast. Then you go there, oh, you're taking too long, let me help you. That doesn't work. Patients do not like people to intervene without offering your assistance. I don't like to use the word help. Do you need any help? I don't like it because help is more like, I'm helpless. I'm telling you can't do anything by yourself, so you need me. But if I said assistance, then it sounds a lot nicer, so to speak. So I always use that. How can I assist you? Do you need an assistance from me? Let me know if you need my assistance, please. That's how you gotta conduct yourself. Don't try to assist them without first asking them if they need your assistance, because they are going to get upset and you are violating their privacy. That is called battery, remember. So you don't do that. So be careful with that. And you're talking to them, also telling them the procedure, you are getting their consent to do the procedure. Because if they don't want it, they say, no, I don't want to do the procedure, so I'm not going to remove my clothes. So don't even continue with anything. Explain them how important it is, the procedure, for the medical doctor to determine what is going on with them and to see what treatment will apply. But if they still insist that they don't want it, no worries. Excuse yourself. Don't get upset. Close the door. Excuse me, Mr. Mrs. Smith. let me step out for a second. I'll be right back, okay? Close the curtains, close the door, whatever it is, give privacy to the patient. Even though they have not changed, because they are in a room and you don't want people to pass by, and start picking inside the room, because the patients are gonna feel very uncomfortable. So you're gonna go to the doctor and you're gonna tell the doctor, hi, doctor, knock the door first. If the door is open, then you knock and then you go in. Otherwise, you wait until the doctor tell you, come in. Hi, Dr. A. Patient Mr. Smith or Mrs. Smith, that you ordered the procedure, she's in the room or he's in the room, but she doesn't want to do the procedure. She says that she doesn't want to do it. I explained her the importance of doing the procedure, but she doesn't want to. So then immediately the doctor says, no worries, let me go there. And the doctor comes over, talk to the patient, miraculously, the patient changed their mind and says, okay, now I'm gonna do it. So don't take it personal. Don't say now, yeah. Now the doctor came, you say yes, but when I told you, you didn't want to. Now you're gonna see who I am. No, there is no such a, revenge or represalias you're gonna have against the patient. That doesn't work that way. You continue like nothing. You do, okay, so please do this, please do that. Nice, because you're gonna have these patients again. Remember, this is not one-time customer. These patients are gonna come again. And if you're rude, if you're not nice, they might not want you next time right there. They might ask for someone else. So think about it. This is how you are going to build rapport, trust your clients. Believe me. So make sure that, that you do the right thing. Any questions? So now the medical doctor comes in. Before we move there, if the procedure, we're going to talk about this later on, but I'm just giving you a little advance, even though if we're going to repeat it and repeat it again. If there is a procedure that the patient needs to be put in certain positions, we have to explain to the patient how to do the position before the medical doctor comes in. But do not place the patient in the position until the doctor shows up. No, explain then how to adopt this position, but then, okay, when the medical doctor comes in, that's exactly what you're gonna do, okay? So I'm gonna walk you through and you're gonna explain then how they should position themselves. Because there are certain positions that we're gonna be seeing later on are very uncomfortable positions. Not only that it's embarrassing for the patient, but you will be tired if you put the patient in that position before the medical doctor arrives to do the procedure. So the patient is going to be tired, the patient is going to be uncomfortable. So when the medical doctor starts doing the procedure, you are already exhausted and you are going to be complaining and you're not going to be cooperating. I'm telling you, seeing this. So that's basically what it is, but we will go over that. So now the doctor arrives, the patient is there. So we are going to be assisting the medical doctor. So the things that we're going to do is we are going to wash our hands. So sanitize hands means just washing your hands with soap and water. Because the patient is seeing you now because now you're going to do procedure because you were doing other errands, you were moving something else before the medical doctor comes in. So you got to wash your hands. You're going to obtain the medical records if the medical records is there. So if you bring the patient, you should bring the medical records with you because you call the patient out, right? to bring it to the exam room. So you should bring the medical records. If the medical records was not available at that moment, the medical doctor has the medical record, no worries. The medical doctor is gonna bring the medical records to the exam room because they just evaluating, reviewing it, seeing what's going on with the patient, what conditions, medications, familiarizing with the conditions of the patient before they do the procedure. We always gonna greet the patient. Remember, you have to greet the patients in a very professional and warm and welcoming way. Good morning, good afternoon, Mr. Mrs. Smith. Please follow me. Let's go to the room, the exam room, or I'm gonna bring you to the doctor's room. Explain then what is it that you're doing, not follow me. The patient says, oh, I thought the doctor was going to call me. What is this other person calling me for? So they are very feeling apprehensive. And now all the questioning, you're going to be bombarded with questions, something that sometimes we don't want, because that's not what I want, being questioned. So just make sure that, that's what you do first. If you have to do the measurements because it was required, or the vital signs, or any other test that is being required prior from the doctor seeing the patient, perform those tests first. So it says right there, measure height and weight. Not every single patient that comes into our office, we have to check the height and the weight. So how do we know when we are going to check the height and the weight? Well, I'm going to tell you when. If it is a new patient, you're going to check height, weight, and all the vital signs and whatever else we're going to go next. If the patient is in weight control, we are going to check the height and the weight. If it is a child, if it is a little kid, you are going to do the height and the weight and something else all the time that the patient comes to meet with the doctor. Height and weight are not done all the time for adults. There are specific times. Remember, weight management, we are controlling your weight. So you're working with a specialist that do so. Probably it's a gastroenterologist or I'm not saying dietitian, but my dietitian is not a medical doctor, but is going to be referred to a dietitian. So these medical doctors will require to do the height and the weight to see if this patient needs to see someone else, a specialist, to control their weight, whether they are gaining to lose weight or to gain weight. Remember, if it is a new patient, a complete physical exam. Every single time you have a complete physical exam, a new patient, weight management, you have to do height and weight. Period. These are the times. And whenever the doctor requires, that is off charts. So, but these are the three major reasons. Remember, pediatrics always gonna have, because they are in this transition, these stages or of growth. So we need to know how they are developing. So for the children, we're gonna do height and weight all the time. For the adults, remember, weight management control, and when you do physical exam, complete physical exam, whether you're new patient or every year or every 2 years that the patient come back to the office. So most of the time, all the patients are established patients, so we don't have to do it regularly. So that's basically what it is. Measure visual acuity. Now, Later on, we're going to talk about how it's done, because it's very important that you know this. So every single measurement, vital signs, procedure that you do or you perform, you have to document it. Only you document whatever you do. You do not document what the doctors do. If the doctor do a procedure, that's the doctor's job to document. Remember, you do not document anything that you didn't do. But you are in charge of doing measurements, vital signs, the visual acuity, electrocardiograms, drawing blood, collecting urine samples. So that is something that you can do, and you have to document it. So there is always a medical record or a log book within the laboratory when we're gonna do the entry. So that's how it works. So little by little, you're gonna get familiar with exactly what is it, what the functions, what are the tasks you are going to be performing in your workplace as a medical assistant. Medical assistants do a lot of stuff, believe me. You guys do a lot of stuff that is within your scope of duty. But you're gonna be doing more things depending of your medical doctor, the medical that you work for. Once again, what specialty they have. Other than that, it's gonna be just routine, basic things. So that's how it works. Of course, I mentioned already, you're gonna take and document vital signs. We have a chapter just for the vital signs. So then we're gonna discuss all these vital signs during that chapter. Any questions? Okay. Gonna continue then with assisting with the physical examination. Now, you can assist the physician with eye and ear exams. You're not doing the exam. You are preparing the equipment, the supplies, and you're gonna be there to assist, to pick up, to clean, and to remove things. That's basically what it is. And if the doctor asks you for something, you're gonna be there because you are a medical assistant. So there are certain instruments that we mentioned before that you're gonna be required to have for the procedure. So think about this. Patient comes and says that, they were working on something or they were outside in the park and something fell off inside their eye. Ooh. Well, you need an ophthalmoscope. You need to prepare the room because the patient is going to be examining the eyes. See, right there, I know what is it that I'm going to be assisting the medical doctor with. The complaint from the patient was, I cannot hear from this ear, or I feel something inside my ear. Then the medical doctor is going to evaluate the patient's ear. So I'm going to prepare myself for that. So I'm going to make sure that the otoscope is ready, that is charged, remember, that is available. Every single exam room should have all this equipment and supplies. But you got to make sure that it's there. Sometimes, people just remove things and then you don't find them. You might need the turning fork. See, medical doctors, they have a desk sometimes in their office. But if it is their desk, which is the exam room, now it's your job to make sure that it's not the turning fork that it was in the desk of the doctor's office. No, you have another one right here in this exam room. So you need to know what is it. And of course, you need to know what it, not only where to find out where it's at, but also how to identify them. How do they look like? Can you imagine the medical doctors ask you, can you, can you look for the turning part for B? And you start going around and around, not knowing what it is. So ask again. Usually I ask the medical doctor to repeat again. I said, oh, I'm sorry, I missed that. What is it that you want me to bring? The turning fork. I have no clue what it was. Okay. So I'm going to go outside and I'm gonna ask some more. Oh, I just tell the medical doctor, I'm sorry. But don't tell them in front of the patient. Don't tell them that you don't know what it is. Because the patient is gonna say, then what are you doing here? Where are you assisting the doctor? You don't know what you're doing. So, you know, just learn how to communicate with your doctor. Give like a look, like, hey, question mark kind of thing. I have no idea what you're asking me for. Then the medical doctor sometimes says, oh, look right inside that drawer. And remember, fork look like a fork. So that's basically what it is. Nasal speculum. Now, you probably don't know what it is, but you have seen it. They have used it on you. These specula are these little plastic covers for the otoscope. It's the little tip that you place on, on the equipment for the otoscope to look inside the ear. So we don't use the actual otoscope touching inside. We use a little cover. Or in the nose, it is a disposable one. Let's see if we have it here. Here they are. See, these are the ones. Look like a little cone. Probably they are here. There are different sizes. They are small, medium, large, and extra large. You need to make sure that you know what it is. See, this is the otoscope. This is the ophthalmoscope. So we don't place them on the ophthalmoscope. You do it with the otoscope to check your nose, your ears. And this is the blood pressure cuff, of course, to check blood pressure. So most of these instruments, once again, this is the thermometer. Most of these instruments are wall mounted. So that is good when they are right on the wall, so you just don't need to be looking for them. Sometimes they are not. So some of them might be on the wall, some of them might not. So you need to go look for them. So this specula looks like little cones like this. And here is going to be connected. Right here is going to be connected at the tip. So we do not put directly the equipment onto the patient's, openings. So that's basically how it is. So get familiar once again. Cannot stress enough. When you start working for the first time, whenever you have a chance, like not much to do, or they not using it for something because you're new, go to the rooms and check things out. That's what I did. That's how I learned a lot of stuff. So when they asked me, I knew what it was. If I didn't know how they look like, then I asked someone else. But most of the things we're going to cover here in class. So that is the speculum. Remember, speculum is singular, specula, plural, many of them. Now, the medical doctor might ask you to pass then the tongue depressor. Remember, tongue depressor are these little wooden spatula, comes in different size that we use. If it is called the tongue depressor, is because what we do not do is mostly is we are going to kind of depress the tongue on the box so we can see. the pharynx, the tonsils. See if there is back there, we see the redness, we see patches, we see some plaques or swelling or something. So that's basically what it is. Every single office needs to have all these supplies because they are only used. So last time, the percussion hammer. Remember, that's the one that we're going to use, to check for reflexes. When the patient is going to have a physical exam, we're going to check for reflexes. If the patient is complaining about having pain in the wrist and the elbows, the knees, any type of pain, anything that might, indicates problems with that area, we're going to check reflexes. So it is important for us to get familiar with these instruments and supplies because we're going to be exposed to them. Then you're going to position the patients for, the particular procedure or exam or evaluation. But we need to be familiar with them before we actually start doing something. So this is kind of the preliminary part of the exam. You're going to get everything ready. You're going to get everything clean. And then you're going to bring the patient. You're going to explain what's going to happen. Remember, you're going to explain in very, layman terms. But then the medical doctor has already explained, then you just reassuring the patient what exactly is going to happen on that particular day. So they are not that apprehensive. They're going to be nervous. But if you tell them what is it that is going to be happening, they're going to be kind of more relaxed versus waiting and see what they're going to do, right? Expecting, and well, they're going to put me here. They asked me to do all this to change, but what's going to happen? I would be very apprehensive, very skeptical. No, why should I remove my clothes? I will have questions. So before they ask me those questions, I just explain then what is it that the doctor has ordered for them. Always tell the patients that the doctor have ordered this procedure. That is not you. Because some of the times the patient thinks, oh, there's this nurse, this medical assistant that want to do that, so I'm going to refuse. But when the doctor comes in, then I was the doctor. So start by telling them that the doctor have ordered blood, that the doctor have ordered an EKG, that the doctor have ordered vital signs, all these things. Because if you don't tell the patient, remember, the patients might tend to refuse. And that is going to kind of, slow down the procedure and probably, time for other patients because this patient is refusing. Now the doctor has to come and explain, and now the patient is going to change. Now the patient is going to put the gown. Whereas they could be done prior to all of this if they have accepted to do it. So it is important. Time management is very important in our because we don't have just patient. After you have to do blood, you have to do this. You have remember, you are an assistant. So manage the time very wisely. Other than that, you're gonna be running out of time. Trying to catch up with things and sometimes staying later than you're supposed to in the office to try to catch up with stuff. I'm the one that I don't like to stay extra hours or extra minutes. No, if I have to finish at 5, 4:36, that's the time that I should be ready to go home. Not fixing stuff because I didn't use my time wisely. But remember, sometimes it's our fault. And the medical doctor is gone already, but you're still there trying to fix things because you have a stuff to finish after you finish with your patients. So again, And you can't just leave things there. Oh, no, I'll do it tomorrow. No, there are certain things that needs to be completed during that particular period of time that you were there in the office. So that's how it works. So be prepared. I'm giving you all the hints for which you have to be prepared. So you're not going to encounter any surprises. So here we have this equipment again that we went over. So that's basically what it is. So just make sure that you know where this equipment is at. Make sure that you clean it. Make sure that you revise it, that you make sure that the speculums are here, then the props or the thermometer covers are there too, because they are not reusable. They are disposable. All those little things that we use here, the speculum is possible. So we have to be replacing them continuously. We need to know where they are so we can place it right here in these little dispensers. So if you go there kind of showing that you have kind of idea of what's going on in the office, they're going to like you. They are definitely going to like you because you are a go-getter person, not waiting for someone to tell you what to do. You are already doing things. So that's how you're going to place yourself on your work. Any questions? Common instruments and supplies used in physicians or for physicals. So here is a tray. We see that tray. Now this tray doesn't have to be sterile because most of these that are there. Some of the instruments probably never gonna use it. So let's go over this before we go into break. So you have to have gloves. Remember, these are non-sterile gloves, clinical gloves. So we have to have them. So here we have some, collection, these cotton tips. Like a large, tips might be needed if the medical doctor is going to do certain procedure, like collecting vaginal fluid, seminal fluid, or the patient is, complaining about gonorrhea, chlamydia, or some secretions coming out from the womb. Who knows? But we need to have time over there. Now, remember, you prepare your tray, your equipment, your supplies, knowing what is the reason that the patient is there. So the medical doctor is going to tell you. It's just that I'm telling you, you need to know what the patient is there so you have an idea exactly what the medical doctor is going to be ordering for this patient. So you're going to be prepared. So when they ask you later on, oh, can you assist me now? Get this, prepare yourself the room because I'm going to do this. So then you go there and you try to figure it out. What is it that you're going to be doing? Remember, when you're new, you don't know, no worries. You ask someone else who's been working there before. Some of the doctors, they are conscious about it. They know that you're new. Some of them, they help you. There are very, very nice doctors, but there is also these doctors that assumes that you should know, that you should have experience. They don't care if you're new or not. So they, oh, you don't know what you're doing. Oh, go over there and send me someone else. I don't have time for that. They will tell you that. I was lucky enough that I didn't have any of these doctors that told me that. But, I told them, what else do you need? I collect this because we know something that we need. We have gloves, we have gauze, we have this, we have depending on the procedure. But if there is something that is missing, oh, doctor, there is anything missing in this table, and then we'll tell you, yeah, can you bring this? Can you bring that? Period. Be honest. Some of the doctors might not know who you are. They might not know that you don't have experience. Might not know that assist a medical doctor doing this particular procedure. No, I have assist other doctors, but I never assist a doctor to do this procedure. Period. You don't have to know it all. Nobody knows it all. Just because you're a doctor doesn't imply that you know everything, because you don't. Nobody does. But you have to be nice with them, the way that you ask, the way that you respond to the requests. So that's basically how you work. So here it is the alcohol pads. See, here is the little spatula or tongue depressor. They come in different size. This is the small one. There are the larger one. See, here is the turning fork. Here is the Wyatt card. This is to check for stools. Here is the Wyatt developer. So this little chemical is used right here when an example of stool is smeared in this card. So here is a lubricant, depending on what is being used for, gauze or cotton balls, whatever they have in that office. And here we have something that is called the telescoping hammer. This is something that you're probably not gonna see it because this is used mostly for orthopedics. This is to check one test that is called the Babinski test. And what they're gonna do is to roll this little thing on the sole of your foot to see if you feel some tickles, some stuff. And that's a different test. This is something that you're not gonna be seeing in a regular office unless you work with an orthopedics or with a neurologist, because we are checking your reflexes on the sole of your foot with this little kind of wheel kind of thing that is going to be passed. I never use this one. Usually I use a little metal or some forceps, and I just scratch on the bottom of the foot, and they're gonna be doing some movements with the fingers, with the toes, I'm sorry. And then I know that if they move the fingers this way, that way, that way, I know what condition they have. That's something that is not usually very common because this is with an specialist. So just worry for, the supplies and equipment. That is very common. Once again, here is when, again, applies what I've been telling you all this time. Know who you're working with, who is your doctor, what is the specialty. So then you know exactly what equipment, what supplies you're going to be using with these people. Remember, always, follow, shadow a, senior, someone else who's been there before, so you can learn from them of how things are done and what things are needed when you're going to assist these medical doctors doing particular procedures. So that's basically it. Oh, here is the pen light. Remember, this looks like more like a cigarette burst, but this is a little pen light. So usually the flashlight is right here at one end, and we just press a little something right here, and the light flashes. Because that light, we use it to check the reflexes or the eyes and to look inside the mouth when we ask the patient to open the mouth and say, ah. So we can use the tongue depressor, and we shine the light all the way on the back of the throat. So that's basically what it is. Now, this is just an example of what can be found in one of these procedures. It's not that you're going to be seeing all of this. All depends on what is it that your medical doctor is doing, what procedure, what specialty they have. So that's basically what it is. Any questions before we go on break? See, I didn't calculate the time, but look at this, it's 7 already. Okay, so let's take a break. We're gonna take 40 minutes. We're gonna go on break until 7:40. Go, do whatever you have to do, and then I'll meet you back. See you later.
See you later.
Thank you. See you later. Okay, so we are back. I hope you guys enjoy your break. Can you hear me? Hello.
I can hear you, Professor.
Oh, good, good. Thank you.
Yes, same
Okay,
here.
so
Same here.
let's wrap her up. Thank you. Appreciate that. Let's wrap her up for today. We're going to continue with this chapter. So we went over these instruments. Remember, we are talking about how to assist the medical or the physician with physical exam or some minor procedures. So that's basically what it is. So don't get too caught off with, oh, I need to know this, I need to know all this. This is a lot of stuff. No, it's not. It looks like it's a lot, but actually when you start working, well, all depends of, what is the specialty of the medical doctor that you work. You probably don't have to do much. Something that you have to understand is that if you work with any doctor, like general doctor, family practice, an internist, you're gonna be drawing blood, you're gonna be collecting urine, you're gonna be doing EKGs, you're gonna be doing vital signs. Those are the most common things. Procedures are not common in a medical office. Usually they are not, unless they are a specialist. If you're working with an ophthalmologist, specialty of the specialty of the eyes, or if you're working with the GYN doctor, with a gastroenterologist, if you work with a cardiologist, now you have to do things related to those particular systems. So it's all different. They vary from specialty to specialty, but then they're gonna train you. Remember, you need to be proactive. That's it. So don't get scared. I'm not trying to scare you away, telling you that all those things you need to know. You don't need to know them by heart. It's to have an idea that this might happen, that these instruments or supplies, you might need to be familiar with them. But if I move to a different place, I'm not gonna know where things are. But then you're gonna get familiar with that. Get familiar with the procedures that the medical doctors do over there. That's basically what it is. Usually, you don't have very, very different instruments. Depends on the specialty. Most of the supplies are the same. What changes is the instruments that they're going to use, depending on the procedure. But anything else is not complicated. So actually, I like to be assisting a medical doctor when they're doing a procedure versus being in the front or doing stock, putting all the supplies, removing things that are expired, things like that. So I'd rather be there because the time goes very fast. Usually during these procedures, you spend at least, remember, with the medical doctor, you spend between 45 to 1 hour. Plus, before you were preparing the room, were preparing the patient, that's like an hour and a half, 2 hours. So that's a lot of time that you're spending only with one patient versus if you are doing something else. So I like to do more procedures than just being in the front, to be honest with you. I mean, that's me, You have your own preferences, but what I'm trying to tell you is like, don't, don't be scared of any of this because you will be trained. You will be learning. You are gonna be asking. So that's basically what it is. Okay. Let's talk about the consent form. There are different types of consent. There is a written consent, verbal consent, there is an implied consent. Well, we will discuss this type of consents in another class for those who are new in the program. Most of the other students, they went through these modules already. So no worries, when time comes, we're gonna go over to all these paperwork that you have to complete or help or assist to complete when the patient comes to your office and register or they have procedures. So that's mostly, the administrative part of being a medical assistant. So for now, because we're doing procedures right here, when the patient is going to, when you're going to prepare the patient and you bring it to the exam room and the medical doctor is going to do some procedures, we have to have a consent form for them. There are certain procedures that do not need a consent form. It is implied, but you have to tell them what you're gonna do, because if they refuse, then it's not something that you just start doing it. It's just part of privacy from HIPAA that you need to explain to the patient what's going to happen. It is common sense, don't you think, that you should know what is it that the doctor is going to be doing before the doctor arrives, because the doctor is not the one who's telling you sometimes. They send you with an order, so you have to explain the patient. So consents, again, most of the consents that we use in medical offices are implied. There is no written consent because most of the things are very simple things. They do not have consequences. For instance, you're not gonna have a consent form to be signed by the patient if you're gonna do vital signs, if you're gonna draw blood, if you're gonna do an electrocardiogram. We don't do that. So for that reason, it is when the life of the patient is gonna be at risk, then we are going to notify the patient, but it's not us that's going to give the consent. It's not you. It is the medical doctor who's going to do the procedure, that is going to explain the procedure, that is going to tell them what are the risks, what are the benefits of doing this procedure, and what are the risks of not doing it. What is the risk if you do it? So all those things has to be explained. What is the procedure? Why are we doing this procedure? Now we have to wait for your answer. You want the procedure or not? If you don't want the procedure, then you have to sign a waiver. A waiver is a document in which you sign as the patient refusal of doing the procedure. So you do not make the medical providers responsible if something happens to you. So that's basically what it is. So not every single procedure is going to need the consent form. They need a consent, which is different. Remember, consent form and consent is two different things, because consent can come in different shapes and forms. So that depends on what procedure is going to be done. Remember, if the patient, when you're doing vital signs, you're not asking the patient, oh, you have to sign a consent and see if you let me do your blood pressure, your pulse, your respirations, your temperature, and the measurements. I'm going to check your weight, your height, so you have to sign a document. No, we don't. We just assume that is an implied consent. You're going to draw blood. The patient doesn't have to sign anything, but you have to tell the patient that you're going to be drawing blood, and they're going to tell you yes or no, because the patient have the right to refuse. Now, if I'm going to do a surgical procedure, I'm going to do a biopsy, I'm going to cut your skin and remove a piece of your skin, your tissue. Now, that have consequences. That injury, that incision can get contaminated. You can get an infection. I can cut something else by the time that I'm cutting through the skin. I might cut a nerve. I might cut a blood vessel. So now I have to do another procedure to fix that. So whenever the procedure is going to have consequences for the patient, then we have consent. So the consent can be written, which is called express. So that's basically what it is. The other consents are not. If you don't have to sign, you just informing the patient, the doctor or a blood. That's it. You telling them that we're going to do a procedure, but you're going to say yes or no, but you don't have to sign any document. But for a surgical procedure, yes. So that's basically what it is. So now, remember, this is not your job as a medical assistant to consent the patient. What is your job is that when the patient has a procedure that the doctor has asked them to sign the consent form, you have to have in the medical chart a copy of that consent, and it has to be there when the medical doctor is going to do the procedure. Why? Because the document has to be there. Prior to doing the procedure, the patient has to be consent by the medical doctor. And the medical doctor asks the patient to sign this document. This document is going to go in the medical records. And whenever you are going to assist the patient, telling them what's going to happen during the procedure, asking them to change, putting them in certain positions for the procedure, then you have to have the consent, because the consent has to be there. But you don't have to ask them for a consent. So that is a totally different issue. See, the consent form is needed for treatments beyond basic wellness examination. So basic wellness is vital signs, blood, urine, all those little things. We don't ask you to consent. Pregnancy test. If you want a pregnancy test, we're just going to collect your urine and we're going to do pregnancy test from there. Oh, now we're going to do a C-section. Oh, that's a different issue. So once again, for procedures that put the patient at the risk, that might be consequences, then we have to consent then using this consent form that is written, information that has to be completed. Must be signed, dated, and witnessed. So pay attention to this, because whenever you're going to do blood, you don't do any of this. Whenever you're going to do an EKG, you don't do this. Remember, these are very simple tests that do not cause the patient to have any consequences. It's not that you're going to put the patients at risk or losing or getting injured or losing their lives during a surgical procedure. Anything can happen. So for that reason, we need a consent form. So the patient is going to sign if the patient agrees with. We have to date it, meaning the date that the consent was given to the patient and the patient signed. And it has to be witnessed. Witness means that patient signs, the medical doctor signs, and the medical assistant or someone else that witnessed the sign that the medical doctor was giving patient consent for the procedure, explaining the benefits, the risks, and what's going to be done during the procedure, and so on and so forth, then that person needs to sign as well. So that's how it works. Because just in case the patient says, oh, I didn't consent to that. Oh, but you signed here. Yeah, but the doctor forced me to do it. Then we have a witness that is going to say, no, I was there. Nobody forced you. The doctor told you about this, and that's how it happens. So there is no any issues for the medical providers. Remember that if the patient refuses to sign the consent, because the patient has the right to refuse, then we are going to ask the patient to sign a waiver. If the patient fails to refuse to sign the waiver, say, no, I'm not going to sign the waiver because that's going to, that's going to put me on the spot. It's going to say that I didn't want to proceed. Well, okay, you don't want to sign, no problem. The medical doctor put it right there where you're supposed to be signing. Patient refused to sign the waiver. Patient refused to sign the consent form. Patient refused to sign the waiver. Patient didn't want to do the procedure anyways. We are covered. And there is a witness. So we are covered. Remember, we are covering ourselves because of a potential lawsuit. So that's basically what it is. Now, the next part that's going to be on that consent form, besides the signature of the patient, the time that, that the consent was given and the signature of the witness, is going to be details explaining the patient what is entailed with this consent, what procedure is it, as I mentioned before. Remember, consent is when you tell the patient, I'm consenting you, I'm telling you this procedure to have. These benefits, these risks, it is needed. This is what we're going to do. That's the reason that you need this procedure. And if the patient accepts, fine. They have to sign, remember, if they don't, that is also fine. But we need to get a waiver signed. Must be done before the treatment. Of course, you're not going to ask the patient at the moment of the treatment, hey, I'm going to do a treatment. By the way, sign this because the treatment is done already. No, that doesn't work that way. The patient has to agree or disagree with the treatment. If the patient agrees, we move forward. If the patient doesn't agree, then we do not do the procedure, period. Now, pay attention what happens if you do the treatment, the procedure without the patient consent. That will be considered not only an assault, but battery. So that's basically what it is. So that is immediately a reason for a lawsuit. So that is basically what it is. Remember, if the patient refuses to allow you to draw blood, you do not threaten the patient. You do not coerce the patient. How? If you don't let me draw the blood, then the doctor is not gonna, we're not gonna see you here anymore. That is called assault. You threaten me. You're trying to oblige me to do a procedure that I don't want to. Listen, this is my body, and I decide if I want or not, even though if this is for my own benefit, but I decide what's best for me, not what is best for you. And if you touch me, you hold me, and you want to draw my blood without my consent by touching me without the consent of the patient, now this becomes battery. So remember, battery is touching the patient without the patient authorization. Assault is just a threat. If I tell you, listen, if you don't come to my class, I'm going to fail you, then that is an assault. It is not battery. I didn't touch you. But if you come to my class and I push you or I hit you, physically, I do something against you, that is battery. So something physical is battery, assault is just words. It is a threat. So keep it in mind because these are questions for exam. So that's basically how it goes. So we have to consent the patient either way, whether something minor or something that is very complex. But if something is very complex, then we need a written consent form. If something is minimal that doesn't cause any harm to the patient, then we just need an implied consent, meaning the patient says, okay, they just not, or they just, you're gonna draw blood and they just raise their arm. I'm gonna draw your blood, sure. Or they don't say anything, they just sit and they just give you the arm. So that is implied because nobody dies when you're drawing blood, nothing happens. The only thing that can happen is that you go there and you don't get the blood. That would be the worst case scenario, but nobody sues you for that. Or because they develop a bruise, nobody's going to sue you for that. That is something that happens. It's very common that a bruise happens, and it's not because of you. It can be because of the condition of the patient. So there's no lawsuits for that. So here is the consent form for a procedure. Remember, here is the person who's going to be having the procedure says, I, Alberto Hoyer, agree or accept that, that this consent has been given to me by this particular doctor to perform this particular procedure. So that's basically what it is. And this paper, this consent form, remember, has to explain. See all the items right here, the nature of the condition. Why am I getting this procedure? Because you're diabetic, because you have a heart condition, because you have an infection, because you have a bad organ, because something. It's got to be a reason why you are doing this procedure. Because remember, then we're going to send this to the insurance company, and the insurance company is going to pay us. But it's got to be a reason why we did this procedure. Other than that, we're not going to get compensated. So again, there are many reasons, but here is just to protect ourselves while we are rendering our services. What is to be done and why? What procedure is going to be done and why is done that way? There is any other options besides, cutting me out and doing this or that, maybe medication. Options needs to be offered as well. An explanation of risks involved with the procedure. Remember, I always been telling you that a consent form is going to tell the risks and the benefits. What are the risks of doing this procedure? Oh, well, you can have this, that. What are the benefits? Oh, this, that. Now, remember, when the medical doctors orders a procedure and asks you to sign a consent form is because the benefits outweighs the risks. So there are more benefits than risks. Other than that, it doesn't make no sense. If it has more risk doing the surgery, well, I might as well, I don't do it. And you shouldn't be offering. It is if this procedure is going to help you somehow. So that's how it works. If there is any alternative treatments, remember other options. I don't want to go under, the knife. I don't want these people to cut me through. There is any other options to get these problems solved, like medications, like radiation. I don't know. Anything else? So if there are, you have to offer it to me and I have to decide which procedure do I want to follow. So it has to be written right there. The benefits. Remember that I told you any benefits that you're going to receive from this procedure as the risks. The risk involves in declining. Now, if you refuse, also, we have to explain there. If you refuse to do this, this will be the risks. And once again, you should not make me responsible for it because you are declining the procedure. So the physician is going to explain all that and is going to make sure that you understand that spoke the language that you speak, or it has a professional translator or a family member. In other words, the patient understood exactly what was going to happen. So then for that reason, I'm going to sign because I know I understood everything that the doctor explained to me about the procedure. Now, this consent also needs to explain who is going to do the procedure. Who else is going to be involved? So all those things needs to be present on that procedure. And that is it. So then the patient signs and we have a witness. Remember, we mentioned that signing that document. Someone who were there, who presents the time that the medical doctor was consenting the patient. That can be you, the medical assistant. So that is exactly what a consent form is. So it's an explanation of all the ins and outs of the procedure that the patient is gonna go through. Remember. Now, these consents are all that are only done for elective procedures. Elective procedures are those procedures that are not done immediately. These are procedures that are done, farther up, because you need some preparation, you need some pre-approvals, you need some bunch of stuff. So once again, if it's something that needs to be done immediately, like in an emergency room, we don't do this. There is no consent form in emergency room.
World Trade Center, they gotta put the
You asking me any questions?
congestion tip and World Trade Center in the city.
It's now oh yeah, I mean Brooklyn Bridge. That nigga not trying.
Oh my goodness, have to mute them. Okay, so that's basically how it works. So be careful with this consent. This consent needs to be present during the procedure. And one of the things that you also need to know is that the patient can refuse the procedure even though after signing this consent. So let me explain it to you. The patient is in the operating room or in, this procedure room. You already, put the position, change, the patient already knows what's gonna happen. When the doctor arrives, the patient says, by the way, I changed my mind, I don't want this procedure. So what do you think we should do? Continue, don't listen to the patient, you already signed? No. We're going to stop immediately. We're not gonna do anything. The medical doctor is going to try to convince the patient, explain the patient how important it is for their health, his, her health, and, that is it. But at no time, the medical provider or anyone who works in that particular medical office should oblige, coerce the patient. Hey, we already have everything ready. How is you gonna change your mind at the last minute? We should not say any of those things. At the contrary, we're gonna try to be as courteous as possible, as professional as possible. Maybe we can convince the patient without intimidating the patient, without coercing the patient. So that's basically what it is. If the patient decides that they don't want to, there is no problem. Finito. Put your stuff away, patient can dress, goodbye, but we are going to ask them to sign the waiver. And once again, if most of these patients, they sign. But if they refuse to sign, and there is no problem. The medical doctor is gonna write down patient refuse, where the patient is supposed to be signing. And then one of you right there at this particular exam room, operating room, is going to be the witness. Yes, that's what the patient says. I sign right here, that the patient refused. So we are not liable just in case they're gonna bring some charges. So basically that's what we are gonna protect ourselves. We cannot oblige people to do something. That can be a heart transplant. If the patient says no at the last minute, we are going to stop. We're not gonna do anything. We're not gonna force anybody. So that's basically how it is. Otherwise, it's gonna be battery and you're gonna pay the consequence. Well, I'm talking about the medical providers. Any questions about this consent form? Anyone? Moving on. So let's talk about draping the patient. Remember, we have the patient in the procedure room, OR, whatever the case may be. So we know already what is the purpose of draping the patient. Remember, the patient has removed the entire clothes or a part of the clothes. So now for the dignity, for the privacy of the patient, which is called here modesty, that's how they call it, we're going to protect the patient's privacy. We don't want to expose the patient private parts. It's very sensitive. So we give them a drape, because remember, we're going to do procedure. So we're going to expose certain areas of the patient's body. Sometimes, if it is a female, it's the breast, very sensitive, or the growing part, males or females, or the buttocks, or the anal canal, or the rectum, the testicles, the penis, the vagina. All those things are very sensitive. So for that reason, we need to protect their privacy, their modesty. We don't want to embarrass them. And once again, we drape them because the temperature inside the rooms usually are cold. And for comfort, remember, comfort means they don't feel embarrassed. They don't feel uncomfortable. Can you imagine if you ask me, well, an example, to get all my clothes off and you put me butt naked right there on top of the table, the exam room. And then you don't close the curtains. And it doesn't matter if you close the curtains. I'm naked. I'm naked in an office with people that I don't know. There are people that is not my family. The people, even though with your family, who wants to run butt naked right there in front of your kids, your husband? No, there's time for that, right? But you don't want to be exposed like this in a medical office. And remember, there is always these peekaboo passerbys. They like to stick their noses every single time that they see someone going into a room. They want to stick their head and see what's going on over there. That's why we keep doors closed, curtains closed, so nobody sees anything, because we are protecting the dignity, the modesty, the privacy of our clients. So it makes sense, right? Good. Let's talk about now positioning the patients for particular procedures. Because remember, the positioning of the patients when we're going to do certain procedures depends on of the procedure that the medical provider is going to be doing, or the procedure that you're going to be doing. Because remember, you can do an electrocardiogram. And if you're doing an electrocardiogram, patient needs to remove clothes from waist up. Put the opening of the gown to the front, because I'm going to be using the front area, the chest, because that's what I'm going to be applying some electrodes, some cables. So once again, not necessarily it's because the procedure is going to be done by the doctor. It's going to be done by you. Then you need to place the patient in certain positions to do these particular procedures. So again, remember what I told you before? Patient's chief complaint is the one that is going to tell me what exactly the medical doctor is going to be ordering for this patient. I have a chest pain. Believe me, 99.999% that the doctor is going to order an EKG. And you are the one who's going to be doing it. So every single time that the patient comes in, we got to be familiar, not just seeing the patient, greeting the patient, knowing what is this patient here, even though if it wasn't you who took care of the patient when they arrive and signed them in. So that's basically what it is. So we need to be familiar with everything that is going on in the office, because you never know when and who is going to be doing these procedures or assisting the medical doctor. So that's basically what it is. So the patient's chief complaint, or the reason why the patient was there to see the doctor, determines the area to be exposed. Oh, I'm here because I need my annual, vaginal or gynecological exam. So, I know what parts needs to be, disrobed, and what I'm gonna do, and what position my patient is gonna be. So that's how it works. You will learn little by little as soon as you start doing this in your practice. And Not your own. No, your practice is where you work. I said my school. It's not my school. I work for them. But it's the place where you work. Sometimes you say my home, even though if it's not your home, you rent there, but it's your home. So my job, that's where you work. So it's yours for that. So that's basically how you do it. Procedure to be performed. So another consideration is, what is the procedure? Yeah, the patient can complain about this, but what is the doctor going to be doing? But that's the beginning. You need to know what the patient is there for. One of the reasons why sometimes we don't know what the patient is there because the patient doesn't tell us. Or the patient tell us one thing and then it turns out that that is what the patient was thinking about it. Oh, I thought that I have this, but eventually the medical doctor encounters something else. So the medical doctor is gonna tell you to prepare the exam room or the procedure room to do something else. And you might be wondering, oh, wow, this patient came for this. I was ready. Now the medical doctor is gonna do something else. This doctor doesn't know what's doing. No, they do know what they're doing. What didn't know what they were doing was the patient, because the patient, remember, chief complaint is symptoms that the patient tell you. But that is something that is subjective. It might be, it might not be. But the findings of the medical doctor, those are objectives. So for that reason, is what the findings that the doctor encountered that I'm gonna follow and we're gonna do, not what the patient told me. Patient can tell me one thing. I have a belly pain. And it turns out that it was not the belly, was something else, was somewhere else. But the patient thought that it was something that in his or her abdominal area, but the pain was from somewhere else. So that's basically what it is. Patient's age. Now, there are some procedures that are not recommended, but, to certain patients. Age, elderly patients particularly. It says right there, older adults, because they might not be stable enough, balanced enough to place them in certain positions that requires someone, to stay still for quite some time. So then we're gonna do little changes here and there. Or if it is a child, remember, or someone who is mentally impaired. So there are many situations in which, we have to consider. Someone is in a wheelchair. Well, it's not the same, if you're gonna draw blood, it's in a wheelchair. I draw the patient's blood right there when the patient is sitting in the wheelchair. I'm not gonna move the patient to the phlebotomy chair, right? Because that makes no sense. So I'm gonna try to do that because it's very uncomfortable for me to do all these procedures. So that's basically how it is. Can you please hold on for a minute? Somebody just brought me something. That's what is tough for a second. So there are many situations or criterias that we have to take in consideration how we are going to position the patients. We're going to go over several positions, the most common positions, and we are going to talk about who's going to get this, how we're going to go about, and what parts of the body and what tests, what part of the body is going to be examined, evaluated, or the procedure is going to be done there, and how we are going to position you for that, and what procedures particularly we put the patient in these particular positions. Because here is where the questions for the exam are going to come. So this part, just the consent. Anything else, whatever is there, is just for you to know, to understand when you have your patients, what is it that you should do? What other, alternatives we're gonna have instead of putting the patient in this position? We're gonna put it in this other position because the patient cannot stand, or the patient cannot stay still for quite some time. When we do a procedure or an evaluation, if the patient doesn't have balance or mentally incapacitated, not going to be able to allow us to perform the procedure of the test or the evaluation. We have to look for other options. So that's basically what it is. Remember, if you have any questions and at any given moment, just please let me know. Let's talk about these common positions. Now, I have there red. If you see these positions that are in red, it's because they are the positions that are most commonly asked in national exam. So that's basically what it is. And in most of the procedures that we do, except for, standing and sitting position, because they are very common, but they are not common questions for exams. Because you're just sitting, you're just standing, they don't worry about that. They worry about other procedures that are a little more complex. So we're going to go over all these particular positions. Standing position, we're going to talk about how the patient is going to be standing. It's not just that you can stand there. No, it's got to be taking certain position. And for which reasons do we do this position? What is it that we're going to evaluate when the patient is standing? Sitting position. Also, what is the patient going to be sitting in a chair? No, the patient is going to be sitting in an exam table. Standing, yes, patient is going to be standing right there on the floor. I'm not going to be asking them to stand on top of the chair or the table, right? Makes no sense. But the sitting position is very common for examinations, evaluations, but it's not a common question for exams. But still need to know it because that's how you're going to start with your patients. Patients needs to be sitting before you place them in any of the positions that are required according to the procedure that, medical doctors going to be performing or the one that you're going to be performing. Supine position. Now, we're just going to mention them, and then we're going to go over each one of them, and you're going to see images, how it is, patient standing, patient sitting, a patient in supine position, or horizontal recumbent, a patient in a prone position. What is it? A patient in a followers and semi-followers position, Sims position, lithotomy position, dorsal recumbent position, knee chest position. Well, see, plenty of positions right there. Now, once again, the ones that you see in red usually are the ones that you will be tested on it. Most of the time, 90% of the time, these are the ones that you will have. Now, be careful right here now that we are in this particular slide. Oh, no. Oh, now it is. Okay, so horizontal recumbent is totally different from dorsal recumbent. Yeah, recumbent is one thing, but one is horizontal, the other one is dorsal. So be careful. So most of the time, you will be asked about supine position. But if supine position is not there, you have to look for horizontal recumbent, not dorsal recumbent, horizontal. Remember, you are kind of lining up right there on the bed. So we will go over those things. So just clarifying this, because I don't want you to, made mistakes with this because all these names are not simple because they are not English. Remember, these are medical terms. And then we're going to start explaining them. Well, standing and sitting, that is English, but supine, prone, the fowlers and semi-fowlers, the seams, the literotomy, these are not terms that we are familiar with. Probably you have been put in some of these positions when you go to the medical doctor, but you didn't know which ones are. They just ask you, and that's what you're going to be doing. You're going to be commanding your patients to take these particular positions, but you know now why. But when you're a patient, you do not know why they put you in this position. Just lay down, just, facing up, facing down. Just recline a little bit. Or let's pull this chair a little bit up or down. But there are some positions that are very, very difficult to describe. We're going to go over so you can understand what is exactly going on with these positions. Okay, so standing position. This is, once again, very important position, particularly for the medical doctors. It is important for you because you're going to be asking the patient to stand right there on the scale to check their weight and their height. So they need to be standing, right? So that's basically what it is. So they need to be standing and they need to be standing still because the medical provider or you are performing some type of procedures. Can you imagine the patient moving around when you're doing the weight and the height? No, you're going to stay still. You're not going to be moving because then you're not going to be able to do the procedure. So again, that's how it works, standing. This position allows the examiner, whoever the examiner is going to be, it might be you, might be the medical doctor, might be the nurse, whoever it is going to assess posture, balance, and gait. So what it means is the way that you stand, whether you stand still, whether you have balance, whether you have problems kind of standing up. So we're going to know. And we're going to ask you to walk forward and to walk backwards. I don't know if you have ever have this test, but this is actually what we do. Think about those videos, those movies that you watch when they have someone who's been stopped by the police because they suspect that they are under the influence. So what is it that they ask them to do? To walk in a straight line to see if they lose their balance. Kind of things is what we do with the patients. We ask them to walk in a straight line and then to walk backwards. Just as if we were testing them for, any of these issues that I explained before. So that's basically what it is. The posture most likely is to determine if the patient has something that is called scoliosis, kyphosis, or lordosis. So there is a chapter there, which is the skeletal, the musculoskeletal system. Then for those who took it, we already talked about these problems with, the spinal vertebrae, deformities. So we're going to ask the patient to stand up, and the patient is going to be standing still, looking forward, and we're going to see if one shoulder is lower than the other. Then we know if the patient has scoliosis. And remember, the patient is going to remove their clothes from the waist up because we're going to see the spine on the back. We're going to ask the patient to bend forward to look how the spine goes, to the sides or stay straight. So these are the tests that we're going to, but these are the tests that the medical doctors do, not you. It's just explaining you why is it that this position is going to be utilized for. So that's basically what it is. So it is used in any patient. Little kids, I do this to check if they have scoliosis or not. For the adults, scoliosis, but mostly kyphosis, which is the hump. You see that they are kind of leaning forward and they have this hump in the back. Well, now I know, and now I know why this person looks shorter than when they were okay, right? So things like that is how you look. Or walking, checking the balance when they walk forward and backwards. So this position is also used to examine the male's genitalia. The male's genitalia is when we examine testicles and hernias. So that's basically what it is. So the patient needs to be standing. So that is it. So when you have a patient who is a male, it is, you don't have to be complaining about anything, or you're complaining about a hernia, like, this inguinal hernia on the side, close to the thigh, right on the pelvic area. The patient said that it has a bulging right there, close to the umbilical. But then, you might say, oh, this patient probably has a hernia. So that's basically what it is. So the medical doctor is going to be doing this procedure, and we're going to have the patient standing. Now the patient needs to remove underwear, pants, underwears is going to be exposed from the waist down. But the patient is going to be with the gown once again. So these are the things that we do. Once again, there is no questions for the national exam that it comes from positions standing. So this is the standing position. So remember, you have to be kind of straight up, because we need to have you as, straight up as possible, and or erect as possible. And we have to explain the patient how to do it, not like just hunching forward, unless you have condition. But that's basically what it is. Sitting position, very, very common position. Every single patient, when we want to do examinations and we're going to talk to them, they are sitting, but they are not sitting in a chair. This is on the exam table, remember. At the edge of the table, at the end of the foot of the table, that's where the patient is going to be sitting. So that's basically what it is. We are going to do this anytime that we start the physical exam, because we are going to be asking questions, and we're going to be able to assess in this patient the head, the neck, the chest, the heart, the lungs, the back, the breast, the axilla, and we can do actually vital signs. We can evaluate upper extremities, which is the arms, and the lower extremities, which are the legs and the foot, right? So that's basically what it is. So this position is very, very, very common. We start like that. And then if we find something during the physical exam, then we're gonna ask the patient to adopt different positions from there. Here it is. Always we're gonna have drapes for the patient. When the patient is not being seen by the doctor and we are getting the patient ready, we give them drapes. They are not transparent. This is just a picture. Can you imagine I'm trying to protect your privacy and I give you something that is transparent? What is the purpose? Makes no sense, right? But this is just a picture of how it looks like. Usually it is a blanket. So that's how it is. Now we're gonna be able to evaluate the front, the sides, see, the legs, the back, the head, the neck, everywhere, the eyes, the mouth, the nose, is a very, very, very common position. And the patient is going to be able to talk when we are examining the patient, because sometimes we just ask questions and we just observe the patient. That is called review of systems. So again, very important position. Supine position, that is also known as horizontal recumbent. Keep in mind, 99% of the time, you will get a supine position. So that will be the answer. But just in case they change things around, you know that supine position is a horizontal recumbent. It's the same. So during this position, which is the supine position, the patient is going to be lying flat on their back. So that's basically what it is. Can you lay on your back, please? That's supine. That is it. Why do I want my patient to be in a supine position? Because I'm going to evaluate or I'm going to perform a procedure on the patient's anterior part of the body. And my patient should not be standing because it might be a long procedure or it's just the way the procedure is done, not only for the patient comfort, but for the medical doctor's evaluation and procedures that needs to be done. So that's basically, can you imagine somebody standing and you drawing blood when someone is standing? The risks of this patient falling, moving their arm, and stacking themselves with the needle, or, stacking you with the needle. It will be very risky, right? So we're going to put them in a sitting position or supine position because we're going to have more control and they are more relaxed. So what would be the areas of the body that we are going to be able to access with a patient putting it in a supine position? The head, the neck, the chest, the breast, the heart, the lungs, the abdominal area, and the extremities. Because remember, the patient is laying on the patient's back. So remember, sometimes you can tell the patient, can you please lay down facing up? That means it is supine. So that's how it works. So if I need to do procedure, for instance, a procedure that you're going to be doing, you're going to be performing an electrocardiogram. You have to place the patient on a supine or horizontal recumbent position. Why? Because I'm going to be using the patient's chest to apply some electrodes, some cables there, arms and legs. But that's going to be an easy way when the patient is lying down on the patient's back. Whether it's a male or a female, doesn't matter. But that's how it works. So that is supine position. Now, one of the little things that we have to consider here is, like elevating the head of the table, the exam table, or placing a pillow under the patient's head or neck. Why? Because there are some patients that have problems, respiratory conditions, or a cardiovascular problems. So when they are flat, they're not going to be able to breathe easily. So for that reason, if your patient has respiratory conditions like asthma, COPD, or they have the flu, or they just say that, they cannot tolerate laying completely flat, you're going to raise the bed a little bit. And if the bed cannot be raised on the head part, then this is what you're gonna do. You're gonna place a pillow under the patient's neck and head. So you can elevate a little bit so the respiratory tract is a little bit more elevated and the patient can breathe easily. Other than that, you're not gonna be able to perform the procedure. All the procedure is not gonna be done correctly and you might have to repeat it again. So those are the things that you have to be very cautious about it. So let's say that you have a question on your exam. You've been asked to, do an electrocardiogram on a patient. You already know that this patient needs to be put on a supine position, but the patient has a respiratory condition. So then immediately, you're not going to place the patient in a supine position. Now we're going to place the patient in another position. So that in this case, it's not going to be supine because we are going to elevate the head of the exam table. Is that understood? So when that happens, then the position changes. We will see that later on. So for now, just supine. What is a supine position? The patient is laying on his or her back, period. Now that I was saying that, I remember something. A question for the exam, most of the time they ask you in which position you will place a patient that you are going to do CPR. So I don't know how many of you knows what CPR is. This is the cardiopulmonary resuscitation. This is when someone is having a heart attack and someone is trying to revive them, resuscitating by doing the compressions on the chest and breathing for them with your mouth or with the mask, whatever the case may be. So if you have a question when they ask you a patient who needs CPR, in which position you're going to place them? Supine. Remember, supine. Because remember, CPR, very similar to doing an EKG. Why? Because the patient is having problems with their heart. Supine. See how the correlation of these terms and conditions are? So little by little, you're going to get familiar with all this. Remember, as of now, you're not going to be getting all this. This is impossible. No one, there is no one, doesn't exist a person that learning a chapter knows everything else just by learning a chapter or going over a lecture. That is impossible. Nobody can do it. Why? Because this is totally new for you. So you have to practice and practice and practice, and then you're going to be able to remember all this. And still, there are going to be certain things that you're not going to know according to your profession, your certificate, because you're not a medical doctor. I know many things because I went beyond what you're doing right now. But for the sake of your program, these are the simple things that you need to understand. So remember, if a patient is laying on his or her back, what position is that? Supine. If the patient, you place the patient facing up, what position is that? Supine. During a cardiopulmonary resuscitation, remember they use the acronym CPR. What is the position that you're going to place the patient? Supine. Do not deviate from the answers. Oh, Professor Hoyo said, what if the patient has a respiratory problem? That's the question is asking you there. It is in the question that it says, by the way, the patient has a respiratory. No, if it doesn't, it's supine. do not worry about anything else. Don't change your answers, because some of the times, because you have prior experiences in your life and you kind of mix information from one position to the next, because remember, you do not know them. So it's going to be a little challenging for you when you are going to answer those questions. For that reason, just straightforward. CPR, what position? Supine. That's it. If you don't see supine, what then you're going to look for? Horizontal recumbent. That is it. Nothing else. You should not be worried about anything else, because that is exactly what the questions are all about. Now, I'm telling you here more information because it's not only for CPR that you're going to place the patients over there. Anything that you're going to do, that you're going to examine anything in the front of the patient, the anterior part of the patient. I'm going to see the patient forehead, head, the part of, the thyroid gland, the neck, the eyes, the nose, the ears. I can see all those things, the chest, the abdominal area, the groin area, the legs. I'm going to be seeing all this upper part of your body. So anytime that I need to evaluate anything on the upper part of the body, then, or the anterior part of the body, then I know the patient needs to be in a supine position. So that's basically how it works. Any questions about these three positions that we have covered? Standing, sitting, and supine. Remember supine, because I can guarantee you that these questions come in your exam, not once, but 3 times. So you need to know it. So this is the supine over horizontal recumbent position. See, the patient is laying flat on her back. Now, when the patient is laying down like this, whether in this case, here we have to pull this part of the table that is inside here, see? This extra part, we have to pull it out because the patient cannot have the feet hanging. So these tables are not long. We have an extra, extension right here that is going inside. So when the patient is laying down, we pull it out. When the patient is not using, we pull it back. So that is how it works. Now the hands of the patients usually are to the sides. That's it. And both sides, very close. You're not going to have the hands hanging out the bed or the exam table. And if you see right here, the patient is being given a pillow. Actually, the bed is a little raised a little bit. Now, to do CPR, you're not going to do this. You're not going to put a pillow. You're not going to raise the bed. No, it has to be completely flat. Well, the patient is almost dead. So we need to try is to revive the patient at that time. So that's basically, so this is supine. Remember, the patient is lying down on his or her back, or the patient is facing up. That's it. So don't forget, prone position. Prone position is the opposite of supine position or horizontal recumbent. So in this case, the patient is going to be lying down on his or her abdomen or belly. That is it. Now the hands are going to be alongside the body or kind of folding them over their necks, depends on the procedure. But the most common one, your hands are alongside your body. So that's basically how it works. Now, what are we using this position for? Well, I'm going to check everything that is on the patient's back. It makes sense If I place the patient facing up, I'm going to be seeing everything in the anterior part of the body. If I'm placing the patient facing down or over the patient's abdominal area or belly, then I'm going to be checking everything that it is on the back of the patient. So that's basically what it is. Remember, for every single position, we are going to give the patient, or we are going to drape our patients. And we're going to use the drapes accordingly, what type of test or what is it that we want to cover? What is it that we want to protect the patient from being seen without the need? So that's basically what it is. So here it is, say, prone position. So just know that this is a position in which the patient is laying down on his or her back. Face down is called. Remember, the other one is facing up. This is face down. There are different terminology that is used when we talk about, these positions in medical. And it's good to get familiar with all these terms because you don't never know which one is going to be used. You're not going to tell the patient, oh, Mr. Mrs. Smith, can you place yourself in a prone position and a supine position? They have no clue what you're talking about. So for that reason, you're going to tell them. They are sitting on the beds or they are standing out, away from the table. Can you please go on the table and lay down on your abdomen or your back or your belly, whatever term, it is more, it is easier for the patient. So that's how it works. Now you notice that these tables, these exam tables are kind of high. So sometimes we have to provide the patients with a little stool or step up kind of, device because not everybody is tall and some of the patients, might not be able to reach the table that is that high. So basically that's what it is. So we need to be aware of this, okay? Because you don't want your patients to fall when they try to go up or when they try to get off from the bed. So it's very important, and we have installed every single exam room that has these exam tables, they have a stool right there for, or this step up, devices so you can provide to the patients. Make sure that you know what it is and you provide them to your patients. Very important. Remember, this is the prone position. They don't have other names. It's just that when we translate them, we just say, laying on the belly or stomach or abdomen. So for your patients, usually tell them, please lay on your stomach. Because if you tell belly, sometimes they don't even know what is belly. If you tell them abdomen, no, they might not know what is an abdominal area. So tell them lay down on your stomach, please, facing down. If they actually clueless, well, you have to demonstrate them what is it that you want them to do. So that's basically how it is. Sometimes we have to do it. The Fowler's and semi-Fowler's position. So now you will be wondering where all those names come from. Well, this is Dr. Fowler's. See, most of the positions are coming from the medical doctor who discovered this position and put these patients in this comfortable position, and not so comfortable position, but a position that assists them to do the procedure that they were allowed, that they were going to do. So what is the Fowler's position? Well, the Fowler's position is a position where you are going to have the patient incline a little bit, not completely flat. So that's basically what it is. So Fowler's position is a position more likely 90 degree. What is semi-Fowler? Well, 45 degree. So the patient is laying down, but you're gonna kind of raise the head of the bed to 45 degree or to 90 degree. Well, this is exactly how the textbooks write this down. But for the exams, they have different numbers. We're gonna see them. Now, this particular position is used to help patients breathe easier. Remember what I told you before, if a patient has a respiratory problem, cardiovascular problem, when you're gonna do a test and the patient needs to be in a supine position, well, guess what? We're gonna raise the bed some degrees to allow the patient to breathe better. That's basically what it is. In other words, if you have a question, because you will, where they ask you, okay, you have a patient and you're supposed to do this particular procedure, but the patient has respiratory conditions. Which position you will place this patient? Semi-Fowler's position. Not the Fowler's, the semi-Fowler's position. Because 90 degrees, like you're sitting up in a table, like in a 90 degree. That is very difficult position. It's uncomfortable for someone who, needs to breathe. But if you kind of incline then some degrees, it's going to be a lot easier. So here it is. So here is the semi-Fowler's position. But I add these diagrams right here to your left-hand side. So here we have, see, this is 30 to 45. That is semi-Fowler's position. This is a 30 to 60 degree, a little more inclined. This is a Fowler's position. And this 60 to 90, this is the full Fowler's position. Do not worry about that. Just worry about this 30 to 45 degree, because that is the numbers that we use, because that's how it works. 30 degree is just enough to put the patient in a semi-Fowler's position. Because what we're gonna do is we're gonna just raise the head of the bed this angle only. We don't need the patient to be this position or this angle. We need them just a little bit, because we need them kind of supine, right? But because they have respiratory problems, we need to raise them a little bit. So 30 degree will do the cut, but 30 to 45, it is just fine. So you will be asked about the semi or semi-Fowler's position, which is 30 to 45 degree. And when are you going to pick this answer, semi-Fowler's position? When they tell you that your patient has respiratory problems. And what conditions are? Asthma. You have an asthma patient. In which position you're going to place them? Oh, asthma, lungs, respiratory. Oh, got it. Semi-Fowler's. Patient has cardiovascular problems. Well, cardiovascular problems mean they cannot breathe either, because they don't have enough oxygen running through those blood vessels, because not enough blood going to the heart. So semi-Fowler's position. The patient has the flu. Patient is coughing, not gonna be able to breathe if you put them flat, semi-Fowler's position. Fortunately, you're not gonna get this question like that. They're just gonna ask you that you have a patient that has respiratory problems. That's it, simple. If they have respiratory problems, you know already that they're gonna be in a semi-Fowler's position, period. That's it, done. Well, I said done with the question, but we are done with the class too. That was constants, that's it. Any questions before we dismiss class? Anything? Yes, no, maybe, probably?
No, Mr. Hoya.
Okay, thank you so much for attending the class. Remember, I'm giving you lots of hints, you know, for the exam and the things that you're probably gonna be needing for your workplace. So I do it because that's the way that I would have loved someone to teach me, you know, to prepare me, not just to give me a bunch of stuff and then help yourself. Because, you know, we have a life away from, you know, school. So we need a little hand. You see, that's assistance. All right, so have a good night. Thank you again. So I will be
Good
seeing
night.
you tomorrow.
Thank you,
Take
Good
care.
teacher.
Good
Good
night.
night.
Thank
Good
you.
night.
night.
Behave.
Good night, bye.
Stay warm because I believe New York right now is very,
Yes,
very
it's
hot.
cold.
Oh, very cold. And here it's very hot where I am because I'm in Brazil.
You
See?
stay. You stay.